Thank you, Dr. Richardson. I'm Paul Doghramji. I'm a family physician at Collegeville Family Practice in Collegeville, Pennsylvania. SLEEPTREE aims to help you improve your management skills in treating patients with insomnia. It highlights the range of issues you will need to consider as you progress through the key steps. You can work through SLEEPTREE by clicking on the arrow by each question or statement at the bottom of each page. Every page gives you the opportunity to obtain information to support the suggested management approach. Now, in some cases, this is provided by links within the text. In other cases, you will need to click the extra information icon on the menu bar at the top of each page. All material is supported by evidence. You can find full reference citations by clicking the references icon on the menu bar at the top of each page. In many cases, references are hyperlinked to the original reports or to the abstracts as they appear on PubMed. In addition, clicking on the SLEEPTREE icon on the menu bar shows you visually where you've been in the tree and where you currently are in the sequence of clinical care. You can also click on the Back button to retrace your steps. You can also click on the Help button at any stage should you require assistance. Now, let's start by asking the question, how and why has the patient with insomnia presented to you? Here we are in the first branch of the sleep tree. How and why has the patient presented to you? You can see here that the patients with insomnia can often present with insomnia, but more often than not will present for some other reason. We can see here that patients coming in with insomnia can have many comorbidities, and this can be tiredness, psychiatric problems, pain, respiratory problems, etc. Clicking the Back button, if we want to see where we are in the sleep tree, we can click on the tree icon, and you can see where you are in the tree. If we want more information, we can push on the eye icon and get more information on how and why the patient has presented to you. Finally, we can push on the References button, where more information can be given in reference fashion. Additionally, insomnia, as we all know, can occur in patients presenting during an annual physical exam. This provides an ideal opportunity to discuss patients' sleep habits and patterns and to identify any problems with insomnias. The next branch in the sleep tree is, does the patient in fact have insomnia? Now, the National Institute of Health State of the Science Conference Statement defines insomnia as a difficulty, complaint, or a symptom of sleep initiation, that is trouble getting to sleep, sleep duration, or waking up too early, sleep maintenance, or trouble staying asleep, or sleep quality problems, that is, waking up feeling unrefreshed. This sleep difficulty occurs despite adequate time and opportunity for sleep and results in daytime impairment or consequences. Now, I invite you to click on the References icon to go directly to the NIH State of the Science Conference Statement. As you can see here, if you click on, this will take you through a hyperlink to PubMed NIH statement. Let's now go back and ask the question again, does the patient have insomnia? The answer is yes. Then what is the history of the insomnia? A critical tool you will need to sharpen in helping diagnose your patients with insomnia is your ability to ask the questions and get the answers. Some of the more important questions are, what time do you actually wake up in the morning? But also, what time do you go to bed? How long does it take you to fall asleep? Do you wake up in the middle of the night? What causes you to wake up in the middle of the night? What do you do when you wake up in the middle of the night? Do you wake up when you would like to wake up? Do you feel as if you need to take naps during the day? How long have you had this problem? Have you had this problem before? Has any physician diagnosed you with any conditions? What have you been doing about your insomnia? These are all critical questions to ask in order for you to understand what the patient's problem with insomnia is really about. Now, the next step in the sleep tree prompts you to ask the question, does insomnia contribute to decreased daytime functioning and decreased quality of life? Now, in some cases, insomnia does not contribute to decreased daytime functioning, and so you may want to consider a diagnosis of no significant insomnia. If this is the case, we can click on the top arrow, which will allow us to give the patient some education about normal sleep and also perhaps instruct the patient on good sleep hygiene. Let's click on the sleep hygiene button, which will get us again to important information that we can relay to our patients. Now, getting back to the original branch 4, in the instance where the patient does have insomnia that does contribute to decreased daytime functioning, we will then consider a diagnosis of significant insomnia and investigate further. The next question to ask then is, how long has the insomnia lasted? Let's click on the actual tree icon to give us an idea on where we are in the sleep tree in a visual fashion. You can see the flashing circle that gives you an idea on where you are. Now again, insomnia can be categorized in a temporal fashion, that is either transient insomnia or short-term insomnia or chronic persistent insomnia. Now, chronic or persistent insomnia is defined as insomnia of greater than 4 weeks duration. In these cases, you should conduct a comprehensive evaluation of the patient, perhaps using some of the following tools. A comprehensive sleep pattern interview may be necessary, where the key objectives of the evaluation are to ascertain some of the following questions: patient sleep habits, sleep patterns, daytime functioning, and sleep-wake cycle. Now, the next critical question in diagnosing patients with insomnia is to ask the question, is it the only complaint or is it associated with another disorder? This is asking really the question whether the insomnia is primary insomnia or whether it is comorbid insomnia. Let's keep in mind that the majority of patients coming in with insomnia will have comorbid insomnia, that is, insomnia associated with some other disease state or medical entity. To ascertain information to give you the conclusion about primary insomnia versus comorbid insomnia, we need to review the patient's records, obtain past medical history, list of medications, and of course, physical examination. Sometimes it is also valuable to do some testing or further investigation. Clicking here, we can see that sometimes, depending on the diagnosis one is suspecting, chemistry profile can be obtained, full blood count, and the like. After carefully evaluating a patient, we may conclude that the patient in fact does have primary insomnia. Again, primary insomnia is defined as a complaint or insomnia lasting for at least 1 month and causing clinically significant distress or impairment that cannot be accounted for by any other etiology. Now, primary insomnia disorders include inadequate sleep hygiene, sleep state misperception, psychophysiologic insomnia.